Hello, I'm Mark Ells, Town Manager of Barnstable, and I'm here to provide you with my weekly community update. You're all fully aware that we continue to move through this recovery relevant to COVID-19. And I have to continue to encourage you to follow all of the proper safety protocols regarding personal hygiene, physical distancing, wearing your mask, um, certainly taking general responsibility for how you deal with and manage this situation. This isn't over yet. If you're following what's going on statewide and nationally, there is a trend upward in positives, positives, and we're seeing that as well here on the Cape. But we're still at the same stage. We're still at the same stage in the recovery process. So we haven't stepped back yet, but I just want to remind you all to please follow those protocols and help us to stay open. If you're wondering what sort of orders and directives are in place, I again encourage you to look at mass.gov and go on their COVID website, or you can go to our webpage and go to our COVID website and then link in to the governor's orders and directives, and you can read about Halloween and Thanksgiving, or you can look at indoor activities and sports, or whatever your or business related orders. So I just want to encourage everybody to continue to do that. I'd also like to ask you, if you have the time, to take a look at our, and you can do this online, take a look at our Board of Health meeting and the discussion in the first half an hour that we had with our Board of Health on Tuesday, and then to watch the special town council meeting that occurred last evening. So that would be the 27th of October and then the 29th of October. Both of them are relevant to our comprehensive wastewater management plan. Our public needs to engage in this, whether it's just watching and following along or becoming more active. We're not hearing from our public, and I'm concerned that this significant effort will get to the later stages, and then people will say, why didn't hear anything about this? So you're going to hear more and more. We're going to create additions to our website. So for example, if you live in the first phases of the sewer expansion that's going to begin this spring, you're going to be able to go in and say, when are they planning to sewer my parcel? So you'll be able to go into your address or your map and parcel number, and you'll be able to look and see that. You'll also be able to see the various costs that are associated with this, that we as residents and you as residents being connected will incur. I don't want any surprises here. I want to share the information as quickly as we have accurate information with our residents. And I want you to know this is real and this is commencing. We're in the final stages of permitting. So if you have time, watch our discussion with our Board of Health, and then watch our discussion and follow along with the ongoing discussions with our town council relevant to our comprehensive wastewater management plan. That's what I have for this week. Stay well, and I look forward to speaking with you again. Thank you.
Hi, I'm Kristen Harmon, Assistant Superintendent of Barnstable Public Schools and Administrator in charge at Barnstable High School. I've been at Barnstable High School to coordinate the work of the administrative team since in-person learning began on September 28th. Our efforts have been focused on scheduling, instruction, health and safety, and general school routines. Here's an update on that work. This week, we adjusted the master schedule to include more learning time on fully remote Wednesdays and added homeroom time for students to engage in topics that support their success. Scheduling for students was also improved with the addition of 10 teaching positions, which created more classes for students to enroll in. We began the year with approximately 800 students who needed schedule adjustments, and that number has been reduced to less than 60. We have 1,300 class sections, and presently 72 are over-enrolled with more students than desks available. Classes with overflow are generally over by only 1 or 2 students. BHS department heads and curriculum coordinators are working with classroom teachers to implement a sustainable strategy for managing overflow. School counselors continue their work to ensure all students are fully scheduled. As we continue to improve instruction in a hybrid or remote model, homeroom teachers are helping students organize teachers' landing pages and the Zoom or Google Meet links for their classes. We're putting a system in place where students can get help with accessing their classes in real time. We also know that students who are learning remotely may have trouble hearing their teacher or seeing instructional material. We continue to problem solve and experiment with different audio-visual solutions. Document cameras ordered in the summer are due to arrive in the coming weeks, and the technology department continues to support our teachers. With regard to the health and safety of everyone at BHS, our hallways and stairways have been marked with one-way traffic patterns for transition between classes. RFID scanners are installed, and students are asked to scan in and out of classrooms and common areas for contact tracing. We have markings on the sidewalk outside to encourage physical distancing during arrival to school. One of the positive habits we're seeing is students are arriving at school wearing their masks, and we're observing a healthy mask-wearing culture in school. An area we continue to work on with students is the importance of physical distancing while transitioning from class to class and during arrival and dismissal. We are staggering class and end-of-day dismissals to reduce hallway traffic during these transitions. Lunch has always been a social time for students, and we want to continue to make that possible while keeping safety protocols in place. We ask students to eat lunch without talking, but once they're finished, they can put their masks on and socialize with their friends. We appreciate the feedback and questions we've received from parents and caregivers. We welcome your ongoing input so that we can continue to create learning environments that are successful for our BHS students. Please be in touch if there's anything we can do to support your child's experience at Barnstable High School.
Hello, this is Pam Saborowski and Alicia Bryant, Directors of Health Services for Barnstable Public Schools, to explain to parents, caregivers, students, and staff the process of what happens when we learn of a positive COVID-19 case in any of our schools. When school nurses, principals, or health services are notified of a positive case, we follow a specific plan determined by guidance from the Department of Public Health, the Centers for Disease Control, and our district physician in how we respond to any cases of COVID-19. If you or your child test positive for COVID-19, please notify the school nurse and the principal immediately. Upon this notification, the school nurses and administration will immediately use public health guidelines to figure out if there are any close contacts in the building. Close contacts are identified as those being within 6 feet of an individual with confirmed COVID-19 for a total of 15 minutes while that person was infectious. This infectious period starts 48 hours before the person exhibited symptoms or before a positive COVID-19 test. For confidentiality reasons, we cannot disclose the identity of the person with COVID-19. If anyone in school is identified as a close contact, their parents, and the student as age appropriate, will be alerted personally by either the school nurse or a building administrator and sent home with instructions on how to quarantine. If you have been in contact with someone who has been identified as a close contact, you are not considered a close contact yourself and do not have to quarantine. A general notification will be sent to the rest of the school, and all parents will be notified that a positive case of COVID-19 was identified in the building. A separate letter will be sent to families of students who shared a classroom or bus with the positive case, but are not identified to be close contacts. No notifications will be sent for a positive COVID-19 test for students who are fully remote learners, as there is no contact at the school. Town of Barnstable Public Health is responsible for all contact tracing outside of school. The plan is to alert close contacts to a person with confirmed COVID-19 first, and the rest of the school will be notified soon after. If you have any questions about this process, please contact the school nurse. For these reasons, it is more important than ever to have accurate, up-to-date contact information on the Barnstable Public Schools registration gateway. You will need your child's local identification number, called the LACID, and their date of birth when signing on. Please take the time to update and confirm the information. This only takes a few clicks. Many students know their local identification number, their LACID, as it is used throughout their school experience. You can also find the LACID in Aspen on your child's report card in grades 4 through 12, the schedule for grades 8 through 12, and in the family portal for grades 6 through 12. We all have a role to play in keeping ourselves, our families, and our community safe. Wear a mask, frequent hand washing, and maintain 6 feet of physical distance are the most important things you can do, both inside and out of school. Please remind your friends and family to do the same. Thank you. Hello, this is Pam Saborowski and Alicia Bryant, Directors of Health Services for Barnstable Public Schools, to explain to parents, caregivers, students, and staff the importance of RFID cards at Barnstable High School.
This year, the district purchased RFID cards for all BHS students and staff to help with our health and safety protocols for the purpose of COVID-19 contact tracing. RFID stands for radio frequency identification. In other words, the ID card contains a chip that can be read by scanners throughout the high school. Students are expected to scan their RFID card upon entrance and exit to each classroom, as well as common areas such as the PAC, Fieldhouse, and cafeterias. The RFID cards are an important component in contact tracing should there be a positive COVID-19 case at Barnstable High School. If there is a positive case at BHS, we will need to conduct contact tracing and determine close contacts for the previous 48 hours. A close contact is defined as being within 6 feet of someone with confirmed COVID-19 for at least 15 minutes. When students scan their RFID cards at each location, we can use that data to determine and notify any potential close contacts.
Beginning on Monday, October 19th, students who arrive at school without their RFIDs will need to go to the PAC or other central location identified by administrators. Students without an RFID will need to remain in this location for the day or until they can have their RFIDs delivered to school. This is not a disciplinary measure, but for the health and safety of everyone at Barnstable High School. Students will be able to access their classes remotely from the central location while they are without their RFID.
We need your assistance in helping our students understand the importance of bringing and using their RFIDs at school every day.
We all have a role to play, and we appreciate your efforts to keep each other healthy at Barnstable High School.